My pregnancy with Kyleigh and her early childhood was perfectly normal. She met all of her milestones. She was crawling and walking and talking. She talked early. But the first day I noticed anything was wrong was the day she dropped and had her first seizure. The first seizure she had was probably the scariest moment of my life because I had never seen a seizure before. I had no idea what it looked like and I had no idea what to do. A few weeks later, we were referred to Dr. Joshi here at the university, and a couple months later, she was diagnosed with Doza syndrome, which is a form of childhood epilepsy.
When she was admitted, Kyleigh was really sick. She was drooling, staring away, was not potty trained anymore. Her speech was very slow and slurred. Her thinking was slow and slurred.
We were on several medications, typically 3 at a time, and she would have so many seizures a day. We were admitted to the hospital almost once a month for several months, and she would just have constant seizures. We started a series of anti-epileptic drugs. Several of them she failed, and so in January of 2012, Dr. Joshi suggested the ketogenic diet, which is basically a hardcore Atkins diet, so it's high in fat, low in carbs.
She went from the seizing very frequently to now seizing maybe once or twice a week. She does have her ups and downs, even now, where she seizes sometimes more than less, but overall she's able to participate in more or less regular school activities. With the diet, I was able to pull away some of the other medications she was on, and she's essentially leading a near normal life now.
Kyleigh today she's now a normal kid. She rode her bike around the block for the first time this summer. She swims, she's taking dance, she's making friends, she's going to start kindergarten, and she enjoys books and coloring again. She's learning to write her name. She's a little slower than the rest of her peers, but she's light years ahead of what she was when we started. Our care here has been exceptional. We were hospitalized so many times that it became like a family. We would recognize people in the hallways and wave and see the same people over and over, and they embraced Kyleigh and myself and my family, and just it was as if we were their own family. They just took such great care of us. To the doctors, nurses, and staff, we'd just like to say thank you. Thank you for giving my kid a chance and saving her life and not giving up on her.